with Dr. Wonder, and he is here to discuss a brand new approach to type 2 diabetes that is changing lives.
Welcome, Dr. Wonder.
Thank you very much.
Why does this continue to be so frustrating and destructive to diabetics?
Well, it's frustrating because most diabetics are diagnosed just on a general doctor's visit. They get some blood, and then eventually the doctor tells them that they're diabetic, unfortunately, and they get a prescription right away. And they're usually given the recommendations of lose weight, change your diet, and exercise. And I'll see you in 6 months. And then typically 6 months later, they go back and their blood sugars are a little more out of control. They've gained a little more weight. Perhaps they have some symptomatology. And the doctor says, we need to make a change. And what a change means is typically either an increase or an additional prescription. And so basically the patient is stuck in this medical model of a pill for an ill approach where their symptom is just being treated with medication. And no one has looked at the cause of the problem. And the cause of the problem is what needs to be found. There could be adrenal gland issues. There could be thyroid gland issues. It could be a problem with their liver. It can be a problem with their gut. They could have leaky brain syndrome, leaky gut syndrome. They could have an autoimmune aspect, which really puts them in what's called a diabetic 1.5. They're not even type 2 diabetic, they're type 1.5. They're now calling Alzheimer's type 3 diabetes. So there's lots of different things where a lot of patients aren't getting to the cause of their problem. And once you get to the cause of the problem can actually be reversed.
Okay, so how is your approach different?
Our approach is different because we're going to do proper testing. Most diabetics, in my opinion, are poorly tested. Yes, they get their blood, their lipid panel done and their CBC, and of course they'll probably check their A1C, but there's so many more things to determine what's causing or what's driving the blood sugar issue. And so these patients are changing their diet, they're reading books, they're going to meetings, they're taking medication, more medication after more medication. And the thing of it is, if that was working, it would be okay, but they get very frustrated because that problem doesn't work, which leads them to the complications. And the complications are scary. Heart disease, stroke, liver failure, kidney failure, blindness, amputation, peripheral neuropathy, Alzheimer's, dementia. Like I said before, Alzheimer's is now type 3 diabetes. So these patients are extremely frustrated because they just don't know what to do, because when they go back to their prescribing physician, typically they're told, change your diet, lose weight, exercise, take this. But the research shows that that model or that level of mechanism approach really doesn't work. When you look at the cause of the symptoms and the cause of the problems with proper testing, then you can reverse the process.
So you can actually reverse the process.
Yeah, when I say reverse the process, what I mean is when a patient then does post-labs, they take the labs back to the prescribing physician, and the prescribing physician will then reduce or eliminate the need for the medication. Not only the blood sugar medication, but prescriptions across the board. We're now seeing patients who are on cholesterol, statins, blood pressure medication, triglyceride medication, who don't even have the problem. We look at their labs and they're on these tests, and I say, well, why are you on these medications? And they say, well, my doctor says I'm going to get this problem eventually, which is true if they stick with the medical model or the pill for an ill model, as I say. And I want to make a point, not that medications aren't necessary. If my blood sugar is 450 and I go into the hospital, thank God we have the medications. Okay, but in terms of healing or reversing a chronic degenerative disease, that doesn't seem to have a good outcome, and the research proves it. Also, when you reverse diabetes, you see patients lose weight without exercise. Most diabetics shouldn't even exercise. We see them start to sleep better. They get their energy back. They get a clear thought. Their hormones work better. Basically, they just start to reverse the process and become a much healthier person.
Okay, this is all fascinating. Can you share a success story with us?
Sure, we've had numerous success stories. We had a patient who was subjected to Agent Orange and was on about 21 different medications, and through the end of the program they were down to 1. So that was a very good success story. We have numerous patients who are actually on insulin, who get their insulin lowered and then eventually taken off the insulin, and multiple patients who are actually just come back with their labs and they're actually not diabetic. And they've told me that when they take the labs back to their prescribing physician, the physician says, if you would have had these numbers in the beginning, I would have never put you on these medications.
So what do you look for in a new patient?
Well, our new patients, for us to accept the case, Health has to be their number one priority. We're going to be asking patients to make significant lifestyle changes. Are they going to have to change their food? Sure. To what? I don't know, because the testing dictates it. Are they going to have to take certain supplements and vitamins? Sure. Which ones? Again, it's different for every patient. If a patient is not, health is not their number one priority, then they are not going to be able to follow the protocol, and I won't take them as a case because I need to make sure our patients get good results. There's numerous diabetics out there, but there's only few people who do what we do. So we need to be very careful and take either the most severe cases, but the people who are not the most severe shouldn't be penalized. They need to be the most motivated patients. But once health is their number one priority, our patients do fantastic.
The Integrative Health Center of Maryland has been very successful in helping patients reverse type 2 diabetes throughout the Maryland area. If someone would like to reverse their diabetes, how would they contact you?
Well, they should just call our office at the number on the screen, and then they can set up what we call a complimentary consultation, where we can go over different aspects of your case to see if anything has been missed, to see any labs that have already been done, and that appointment, that consultation is complimentary, and from that point we can move forward.
Okay, great. Sounds easy and sounds like a good move for them to contact you.
Thank you.
Thank you so much for taking the time out of your schedule to meet with us today.
My pleasure.